But it's taken 15 years, well, maybe close to 20 years for us to actually recognize that these drugs have some, and partly due to the fact that more people are using them. And if you have a really rare side effect, you're not going to see it at the beginning when few people use them. But when lots of people start using them, that's when you start seeing more problems with these drugs. And there's been a gap, maybe 15-year gap between what we knew and then starting to adapt that information into prescribing and so on. So adverse drug reactions. One of the things that you often see, and this is a whole kind of area of study, is that people who are given certain drugs start exhibiting certain types of behaviors. And those behaviors are not recognized as adverse drug reactions. Physicians essentially are not taught that, or they're not taught very well that certain drugs can cause severe adverse reactions, and those adverse reactions are conditions unto themselves. A lot of times they'll try to figure out what is wrong with this person. Do they have bipolar? Do they have this or that? Without thinking the problem is actually the drug they were given, not a new condition. It's an actual drug adverse effect. In terms of the SSRIs, again, withdrawing slowly is the major advice that physicians are given, and a lot of people have some difficulty trying to withdraw. There are places that you can get help doing that. And does anybody know what that condition is? I figured there'd be more women than men here, so I thought I should talk a little bit about PMS. This is a really interesting story. Fluoxetine, that's the generic name for Prozac. Fluoxetine was coming to the end of its patent life, and Eli Lilly, the manufacturer, decided a good thing to do was try to find a new condition and get another patent for this drug. So they got a group of women who suffer from what we would call extreme PMS, or it was labeled in the diagnostic manual of psychiatry called PMDD, which stands for premenstrual dysphoric disorder. Okay, so PMDD was in a sense created, and they tested this drug in these women that had this condition called PMDD. They found some level of benefit, and they said, okay. They went to the regulator, to the FDA, and said, can we have a license for using fluoxetine in women with PMDD? They got approval to sell the drug. They changed the color. They changed the name. Bingo, new patent. So you wonder why our drug bill keeps going like this. So I don't know if you've seen Prozac, but Prozac is kind of lime green and yellow. But they changed it to lavender and pink. So we call this Prozac in pink. What's funny about this is that, I mean, I'm not saying that women with extreme PMS shouldn't try to take whatever medication they think is going to help. I'm not saying that. The condition itself is highly controversial in the sense that the regulators in Europe looked at this and said, we're not going to license that drug because we don't think the condition even exists. So it's quite interesting when you look at what happens in the US and Canada and Europe. Different countries look at the same set of data and say, go away, forget it. We don't think that even exists. Anyway, Serafem is not sold in Europe. What's interesting though is that you get someone who's super highly kind of energized, and what you're doing is planting the seed. Think it's PMS, think again. Right? Could be PMDD. The only reason why you would want to transform your condition from PMS to PMDD is that you can take a drug for it. And there's an approved drug for it. I was going to talk a little bit about antipsychotics, but I'm going to jump over that, unless there's some questions in the crowd at the end. Okay. So I have one slide on antipsychotics. These are drugs like Seroquel, Zyprexa. These are extremely, I would say, toxic medications. They're approved to treat people who have schizophrenia, bipolar disorder. The condition itself, schizophrenia, is quite, as you can imagine, it's quite controversial. There's no way to really diagnose whether someone has schizophrenia. You can't take an X-ray or check their blood and find any marker of that disease. The treatment, in this case, is not used that much in young people, thankfully. It's more often used in elderly people in long-term care facilities because the drug is quite effective in basically taking agitated people and making them calm. So yeah, these drugs are for psychosis, schizophrenia. There has been, again, a fair amount of controversy around the use of these drugs in children. I don't think we have much of a problem in British Columbia, though I did a study 2 years ago looking at the prescribing of these drugs in children in British Columbia, and there were something like 4,000 kids in BC who were prescribed antipsychotics. The drugs are not indicated for children, which means they are not supposed to be used in children, and they get used. Now, again, these children would probably be very troubled, and maybe the physicians and the parents are at the end of their rope, and they would be willing to try anything, even extremely toxic drugs. But the drugs come with a range of problems, including weight gain. I remember a psychiatrist in Victoria, I was talking about these drugs with him, and he said, I'll put a patient on Zyprexa, which is the sort of top-selling antipsychotic, and a month later they'll come back and see me, I don't recognize them, because they've gained so much weight. They've gained so much weight. So that's fairly shocking. And the other major effect is they really play havoc with your blood sugars and diabetes. It causes diabetes. And in that case, you would hope that you would monitor things really closely, and that any drug that you're giving a kid anyways, that you're using the smallest dose possible. And maybe that's what's happening here. Because the known side effects of these drugs in kids, I mean, the companies do not have a license to market these drugs to children. And the reason that is that when the companies went to the regulator at Health Canada or the FDA and said, can we have a license to sell these drugs, to be able to market these drugs to children, the regulator looked at the data and said, forget it. These drugs aren't safe. You know, these drugs are beyond what we think would be appropriate in children. Asthma, the newer asthma treatments, again, they have been, there's a group in the US called US Public Citizen, and they operate a website called Worst Pills, Best Pills. And they have about 5 or 6 doctors on staff, and they do what I would consider to be kind of weapons grade analysis of drug studies. And they've labeled these drugs as do not use compared to the other range of asthma treatments out there. Essentially, their assessment is the older treatments are as effective and in many cases safer than the newer treatments. So older stuff like beta agonists, albuterol, Ventolin. A lot of people are quite scared to be using steroids, prednisone, and so on. There's a lot of concern, especially in children, when you start using steroids in terms of the effect on their growth and that kind of thing. So let me just shift a little bit and sort of ask you or suggest, where are people getting their ideas about drugs? And where do we sort of conceive of the nature of disease and the nature of healthcare, medical care? I would argue that we can blame lots of different people, so no one agency is to blame. Obviously, you've got the drug companies in the background, and they are doing what I call selling sickness, but you've got the participation and the influence on the doctors. You've got the media that oftentimes will exaggerate the benefits of treatments to sell a story. And you've got drug advertising, which, drug advertising in Canada is not legal. Does everyone know that? Does anyone not know that? So, you see a lot of drug ads when you're watching TV, if you watch TV. Those drug ads are on American channels, for the most part, because we're not allowed to do what we call direct-to-consumer advertising in Canada. It's not legal. Though, of course, we live by the border and we get a lot of American television, so de facto we get direct-to-consumer advertising. And advertising is big business, and the average television watcher of American television consumes something like 14 drug ads a day. So you have to ask yourself, what kind of effect is that having on the psyche of your average person when they're consuming that much marketing around drugs.